We are now talking on a specific thread in AskReddit. Hospital workers, what regrets do you hear from dying patients? I work in a hospital. Whenever someone is at the end of their life, they always just want to be with their loved ones. Any regrets I've heard is always family related. They wanted more time with the people they love. Most people are at peace with things though. People also tend to wish they took their health seriously. I was a hospice nurse. One of my elderly patients had skin cancer, a huge malignant melanoma on the side of his neck that was growing rapidly. He had been a farmer all his life and never married. One night we were talking and I asked him if there was anything he wished he had done differently in his life, and he thought about it a minute and said he wished he had worn a hat when he was farming. I wish he did too. End of life physician here. CPR. No, seriously, hear me out. Imagine using your hands to crush the sternum down 2 inches repeatedly of your 90-year-old grandmother who weighs 90 pounds so that maybe you can then put her on a ventilator from which she might never get off alive. We ask this of everyone who comes into the hospital, but too often it's asked more like, hey, if you're drowning, do you want us to save you? Rather than what it truly is, especially for those who most likely won't survive it in the first place. And if they do, will be significantly worse off than they were before they died. The survival statistics for patients with 1-2 significant comorbidities with an in-hospital cardiac arrest is like 5% to leave alive, and then 30-day survival is 5% of that original 5%, if I remember correctly. I cannot count the number of times families were adamant on having it done to their loved one only to then see what it entails firsthand and beg us not to do it again. I worked as an oncology nurse right out of nursing school. I was barely 21 years old. Had a patient about my age who was dying of lung cancer. A few hours before he died, I sat with him and he was telling me how much he wished that he would have had more time to maybe fall in love, marry, have kids. He was so young. He asked me to call his parents and he died shortly after they arrived. It was awful. His regrets were more about the life not lived. Many older patients had some interesting life stories and most wanted to tell them before they died. Most were at peace with the life they lived. Many regretted working so much and not spending enough time with family. I was a new nurse, flying solo. We got a call for an incoming trauma woman in her 50s involved in a multi-car accident. We were already at the ambulance bay, unsure of the woman's complete condition. She rolled in breathing on her own, but very labored with asymmetrical chest expansion. She was profusely bleeding, had multiple deep lacerations, pupils blown, debris covering most of her, etc. Her vitals were unstable. She was circling the drain. We knew she was on the verge of coding. I was standing near her head, ready to assist in supporting her airway but also providing comfort and doing my best to calm her. The woman looked me directly in the eyes and in a hoarse, labored voice stated, "I was angry." I told her I was disappointed in her. She began to cry, her vitals plummeted. "I'm sorry," was the last thing she said before her heart stopped. We coded her, intubated her, performed round after round of ACLS, only to eventually have to call time of death. I still see her face at times, her eyes filled with more emotional pain than physical. It took much longer and was so much harder to write this than I thought it would be. He wished he had been a better father to his daughter. He wished they had reconnected. His dementia prevented him from remembering they had reconnected years before and that she visited often. I wish I could have made him aware that he had accomplished his last wish. But he died not really understanding that.